some of them absolutely seems like just a review, but actually we just emphasize different aspects. For example, the pathology, diagnosis. What's the difference? So pathology, we mainly talking about the how many possible factors, right? So the wind, heat, the summer heat, this is the factors, right? And what's the change? So the change is talking about, for example, we're talking about summer heat, it's too hot, force the body fluid come out, the patient might show profuse swelling. This is the pathology. We're talking about that. But the question right now, diagnosis is, why do you say this is the summer heat? Based on what symptoms, you can say, oh, this is the summer heat. Now, this is the diagnosis. Just like cold contraction, cold condensation, that water from the water to the ice, right? This is the pathology. And the cold invade the body and the blood condensed or like a condensation, get a blood stagnation. So the cold causes blood stagnation. This is the pathology. But right now, the diagnosis means, why do you say this is the blood stagnation? How do you know this is blood stagnation? This is diagnosis. Why do you say this is blood stagnation? Because I notice color change. Color is the purple. I notice the patient feel pain. I notice there's a swelling over there. So this is the diagnosis. But absolutely there are some like pathogenic change in it, right? So you say, oh, why this is swelling? Why this purple? It's because blood circulation slows down. Oh, that's purple, right? Why this is swelling? It's because something accumulated. So you know the pathogenic change inside, but the diagnosis is emphasize the manifestation. Okay, I need to remember the manifestation. Which one indicate blood stasis? Purple face, purple tongue, and swelling, and like a mass, or the patient has a pain, right? But this is about the diagnosis. So sometimes I should see the like pathology. If we're talking about pathology, pathogenic, the change is the whole body change, but just sometimes for us easy to remember something, I should say, oh, this one divided into this, divided into that, just like a blood, or what blood pathogenic change roughly divided into first volume change, second circulation change. So volume change, you just say, oh, because the bleeding, because lots of like blood volume get lost. So that's the volume decrease. Decrease mainly show the size change, like blood vessels get smaller, right? And the color turn to the pale, right? So all of this is related to the volume. But some of them is not related to the volume. I just see it's mainly the function, just like last week I was talking about. What's the blood? The blood contains the yin and the water, and the skin very dry. Sometimes the pale color, so you can think about the color, pale skin color. When it's blood volume decrease, the color tends to pale. But if it's the very dry, very itching, what the itching related to the blood deficiency? That's the blood nash, right? Okay. Why the poor memory, poor sleep? Why the poor sleep is indicate the blood deficiency? Right? So that's the talking about the blood's function. Blood's function. Okay. So this is also a summary from the manifestation. So some of them from the inspection, some of them from the inquiry, some of them from the handout 4, handout 5, like tongue observation or post taking, right? So inspection or inquiry, you can ask. Look at this. Distension greater than the pain. So that's the ask a patient, right? That's the handout, like diagnostic 1 and 2, talking about like inquiry. Unfixed pain. This is all ask a patient, what's the pain? From here to there, or just stay just in the one location, no change. That's the fix or unfixed. So all of this is from the handout too, like a inquiry, right? Or sometimes from the inspection. Inspection means what's the color? What's the color? Purple face. Tongue observation. This is from the inspection. Distincting pain, failure, fullness, statement. This is also from the inquiry. So this is just the pick up the symptoms, manifestation, or signs from the different chapter or put it together. So we'll say, oh, this is the chi, or this is the blood stasis. This is a comparison about the blood difference between the blood stasis and the chi stagnation. So chi stagnation emphasizes distincting, and the blood stagnation emphasizes the stabbing, pricking, or like a word, like a severe cramp, or so this is after the blood stagnation. So this is about the syndrome of blood stasis with the chi stagnation. Theoretically, we know that the development. What's the development? Because we're talking about the chi's function. Chi push the blood, so that means once. Sometimes we don't know how long it takes. For example, you say, oh, theoretical chi stagnation finally may cause the blood stasis. This is just talking about development. But sometimes it's time short, sometimes time it's a little bit longer. But we don't know. We just based on the symptoms change. If there's symptoms change, we say, oh, there's a change. So if the patient still show the distinctive mania, or still even like a couple years, was oh, this is just a chi. So this is about chi stagnation finally leading to the blood stasis, right? But we talking about many times about, oh, why does chi stagnation? 5 pathogenic substance obstruction. Which one? Food, sticky mucus, right? In the blood course. So that means blood course obstruct the chi. So finally also cause the chi. So that means chi stagnation causes blood stasis. The blood stasis absolutely might obstruct the chi. So that's chi blood exists at the same time. That's very common. Okay. This is about diagnosis, but from the diagnosis, and you can also think about about the treatment, chi, blood. When you learn the herbs, the herbal like herbal 2, herbal 3, there's chi herbs. We call chi herbs. All the herbs in this chapter for qis, increase the qi movement. We call the treat the qi stagnation. But there's another chapter, all the herbs in this chapter for blood stasis. So that means 2 chapters, right? And how to use that. So right now, back to here. Chi stagnation finally causes blood stasis. That means once the blood stagnation formed, that means the chi stagnation is still there, right? So that means absolutely no problem. Chi herbs, blood herbs used together. So this is the one. But right now, the diagnosis is just the blood stagnation. Just blood stagnation. We just assume, oh, once the blood stagnation, I'll find it may obstruct the chi, right? But in treating the blood stasis, so what's the principle? Anytime when you treat the blood stasis, you must add some chi herb. Must add the chi herbs. But the question is, once you treat in the cheese stacking, should you add the blood herbs? No, you don't need to add blood herbs for. That means just cheese herbs treat in cheese stagnation. You don't need to add the blood stagnation herb. But for treating the blood stasis, you need to add the blood. You use the blood herbs, right? And also plus the cheese herbs. That's the principle about this. So once you learn that herb is 2 or 3, you should know that's the form here. Okay, process with qi stagnation. So move the qi evacuate blood. The herb formula. Yu in Chinese. Yu. It means stagnation, blood stasis. ZHU, expel the stagnation. And how many? There are 5. TANG, that means decoction. That's the formula name. So they are totally 5. We call the Zhu Yu Tang. This is there. In the Qin dynasty, in Chinese history, there was doctor called Dr. Dr. Wang. So he created 5 Zhu Yu Tang. So that means 5 formulas for blood stagnation. Why there's 5? Because different location, dependent different location. For example, the blood stasis in the chest, blood stasis in the abdomen, and the blood stagnation in the whole body, or blood stagnation in the brain, on the head. So that's a different location. So these locations just, think about the herb tendency. So I pick up different herb, let the herbs mainly go to this location. That's the reason. So that's why there's an herb tendency. So this herb mainly go to the middle jaw, or mainly go to the chest to treat the blood stagnation in the chest. Okay. This is the formula development. In the blood deficiency, we already know that the 四无糖 SI, this is 1, 2, 3, 4. So this formula actually is the classical formula for the blood deficiency. But the development from this one to here, so add 2 herbs. That means there are 6 herbs here, 1, 2 here. So called the TAO. That's TAO here, TAO. That's the HONG from this, like a red flower. So 1, 2 plus this 4. So this called the Tao Hong Shi Wu Tang. Once add these 2 herbs into this formula, the formula function change. Why does it change? Because these 2, this is not a totally blood, this is evaporated blood. So that means this formula is for blood stasis. Okay, so in the herb function, we already noticed that. You say, oh, this is for the blood deficiency, right? But actually, there's 1 herb here, and another herb here, the Dangui. Actually, Dangui function first the total blood deficiency, and also evaporate the blood. So this one already contains like evaporated the blood function of there, and the tradition no tonification function. The tradition is only for blood stasis, increased blood circulation. So that means once these 2 herbs plus these 2 together, that means increased evaporated blood circulation function. So this formula change the function to evaporate blood for treating blood stasis. So once you learn the internal medicine, you can remember that. What's the 四物汤, what's the 桃红四物汤, the difference. Okay, so the 猪鱼汤. So once you remember that 6 herbs. So these 6 herbs, or you can see this formula, becomes a basic formula for treating all the blood stasis. The difference is I need to add the herbs, guide this herb to where? To upper jaw, to the middle jaw. So you can see this the 注语 expel the stasis or stagnation. This is the expel the stagnation, right? So what's the difference? Share, XUE, this is the blood. FU, this is the house. What's the blood house? Blood house, chest, heart. So that means this is for, you can see the formula in the clinic. So you can say, oh, which one I should choose? 血府. What is 血府? 血府 is for chest, like heart, blood stagnation, or the blood stasis in the chest. What's the GER? GER is diaphragm. 下 below. So below the diaphragm is what? Middle jaw. So this is for the middle jaw. This is for upper jaw. But once you check the herbs here, so TAO, right? HONG. What's that? 1, 2, 3, 4, 5, 6. So 头是汤, right? So 头是汤. But the difference is, you can see some of the herbs. There's why they highlight qi herb. Qi herb. How many? 2 qi herbs. Okay. You can see this one, this one, this one. Like a sour, we call the sour bitter orange. This is different, big difference from the sweet orange. This is not here, but use the small one. This is the stronger effect to move the qi. So 1, 2, 3. So this is, I sometimes I use this formula to confirm or to explain the relationship between qi and the blood. So the formula is for what? The formula is for blood stasis. Why there are 3 qi herbs in the formula? Why this? That's just about the qi herbs increase the circulation, can help evacuate the blood. So the formula is for blood stasis. But there's qi. Actually, there's qi herb. That one qi herb, there's qi herbs, right? Okay. 少服 this is 注意 right? This is the 注意 right? So 身痛 aching, 身 whole body aching. That means caused by blood stasis. So that means this is for treating the whole body aching due to the blood stasis. You can say 头儿红化当归传雄 right? This is the 头是五汤. And 少腹 the fu here the little bit different Chinese, right? fu means abdomen. What's 少腹 means lower abdomen. So 少腹 lower abdomen. Lower abdomen. So that means especially the blood stasis in the lower jaw. For example, use this formula for treating the fibroid uterus for blood stasis in in the lower jaw, generally speaking, lower jaw. So this is the good one. This is for whole body. So there's another one, 活血 actually is evacuate the blood. 通窍 通 T-O-N-G, 通 means unblock. 窍 Q-I-A-O, 窍 means what? Like we call it like a nose, ear, eye, all this is the 窍. But finally the 窍means like keep conscious. For example, lost the conscious, we call the 窍 was blocked. So patient lost the conscious. So that means if you can keep conscious, that means the 窍is still open. So that's the one we call it 窍. 窍actually is the already changed to another meaning about the brain. The brain normal thinking about this is the 窍, normal function. Once the lost the consciousness, that means the 窍is blocked. So that means we use the word strongest stimulation, for example, like due 26, stronger stimulation that the patient open. So that's what we call the 通窍. And once the blood stasis blocked in the brain, we can 通窍. So this is the blood stagnation in the brain. So that's 1, 2, 3, 4, 5. All this is for blood stasis. Syndrome blood stasis with cheese. Let's talk about the four acupoints. Syndrome blood stasis with the Qi deficiency. This is about a little bit of difference. What's the difference? The difference is sometimes we're talking about blood stasis only. I know this is blood stasis, but I don't know why. It's because in the pathology we're talking about 1, 2, 3, 4, 5 different reasons to cause blood stasis. For example, the patient had the cold disease before, and because the young deficiency and the blood circulation slows down, so the result is blood stasis, right? But the primary reason was cold. The question is, can you track the patient's history or the follow-up? I know, you was cold, right now it's blood stasis. I know the development. That means great, you know. But sometimes I don't know the development, I just know the result. Or the patient that had the Qi deficiency before, without enough Qi to push, so the circulation slows down, the result is blood stasis, right? So, but the primary reason was Qi deficiency. So, if you know the development, that means that's great, you know. But sometimes I don't know because the patient is first time to visit me, and I don't know the past history. I just know right now is the blood stasis, right? So, but from the inspection, from the inquiry, you know the patient contains some Qi deficiency symptoms and the blood stasis symptoms. So you get the diagnosis. Oh, okay, so this is, I just assume maybe this blood stasis is because the Qi deficiency first. But they just assume. But right now I just pay attention to the current symptoms. The current symptoms, patient that has both Qi deficiency and blood stasis symptom. So that means for the diagnosis, you can simply just put all the symptoms together. First group, all this Qi deficiency. This group of the symptoms, blood stagnation. So I should see sometimes once the blood stagnation form, the symptoms much stronger than the Qi deficiency. So sometimes you just notice that the patient seems to only show the blood stagnation. For example, purple tongue, like purple spot, or the purple facial color, or the painful sensation, or even show the mass, right? It's easy for you to think, probably this is only blood stasis. But except this patient, if it shows some other symptom, what other symptom? Body constitution. For example, weakness body constitution. This patient is strong enough, or it's like a low body weight, skinny body weight. This is the one. And the second one, how's the energy? Because we emphasize the Qi. What's the Qi function? Qi means support. Support everything. Speaking, exercise, walking, everything. Like a daily activity, housekeeping, everything. This is Qi support. So once the patient complains about, I don't want to do anything. I don't want to do housekeeping. I don't want to do any labor work. This is very important symptoms for diagnosis about the Qi deficiency. So except the purple tongue, purple face or something. Okay, so for example here, the first group, the second group. So you can see the difference, right? This is just emphasize the Qi deficiency, and this one emphasize the blood stagnation. So sometimes we can use the formula as an example. So from the beginning to the end, most of this is from beginning. This is the qi, this blood, so that means I set the treatment principle, and they totally the qi and the evacuate blood. This is from the beginning to the end, again the formula. But sometimes we can form the formula. We use the formula as the example to emphasize, to memorize. What do you mean to emphasize? For example, the formula name is this formula is also from the Dr. Wang. I mentioned the 5 Zhuyitar from Dr. Wang. This formula is also from Dr. Wang, and he's especially interested in how to treat the blood stasis, right? In what condition, or in which different location. So, in what condition? In qi qi deficiency and blood stagnation condition. Okay, okay. Look at the formula. You're already familiar with this, right? TAO, right? This actually TAO is the pitch. The pitch is nuts, right? That's for evacuate blood. The red flower, translation, right? All of this, blood stagnation herb. But the question is, you remember last week I mentioned one, Huang Qi, elevation, increase, stronger totally the qi. So you can see the dosage, 120. That's a little bit scary. 120 grams. And even this 1, 2, 3, 4, 5, 6, but all of them like 6, 10, totally all 6 herbs probably just around the 60. But the one herb, 120. So what is this herb? Qi, strongly totally the qi. So there are herbs to evacuate blood, but the chief herb, 120, stronger totally the qi. So this one is especially good. People use it for, the doctor use it for like after stroke, one side of the body lost the function, paralysis. So there's blood stagnation, but there's a qi deficiency. So that's the good formula. So then we can use this formula to as an example to see the pattern. This pattern contains the qi deficiency. Also, the purpose. My purpose is not for totally qi only. My purpose is trying to remove the blood stasis. But the question is how to remove the stasis and increase the qi's function to remove them. So because the patient has a qi deficiency in the blood stasis, right? Okay. The syndrome of the blood stasis and the blood deficiency. Well, this one I should say a little bit complicated because let me explain a little bit. This is about the blood in the blood vessel, right? Generally speaking, talking about the blood equals into the water, right? That's just the food, the water. So we already talked about many times about the qi deficiency cause the blood stagnation, and the cold first. The cold causes blood stagnation, right? But actually, you mentioned 1, 2, 3, 4, 5. But actually, among the 5, there's another one about heat, fire, cause the blood stasis. So in the pathology, we explain why the fire, the heat, cause blood stasis. That's 1, 2. General speaking, or maybe there's 3. But we just mentioned about first one. Somebody say, oh, fire means burn. Just like a fire burns something. Burn the small blood vessel. So it might cause bleeding. And then if the bleeding, the blood stays inside of the body. That's just blood stasis. And second one, fire heat increase the circulation. So circulation increase, just like a high speed, easy to cause the accident. That's the same thing. So this is another one. But the most important is the heat. consume the yin and the water. Just like Dr. Ye, Dr. Wu said that once the Adamic warm evil qi into the blood level, so might cause bleeding, but might also consume the yin and the water. So once this consumed the water, the blood getting condensed, concentrated, condensed, get more sticky. So that's easy to get the blood across. So that means, remember, the heat or fire might, except the qi division, except the cold, the heat or fire also cause the blood stasis. So that means if the heat or fire cause the blood stasis, they already consume the water, already consume the yin qi. Consume the yin qi, consume the water, what's that? Deficiency, right? It's a deficiency. So there's deficiency, blood stasis. So this is about the one important, it's not the only one, there's some other reason. So, for example, the bleeding causes blood stasis, but the patient also has the blood stasis. That's also possible. Okay, so you can see of the first one. This is talking about the blood deficiency symptoms. Blood deficiency symptoms. So I should see sometimes we collect all the symptoms from the signs and symptoms from the patient. Some of the symptoms cannot explain by using one pattern. For example, can you use one pattern? For example, I believe this is blood stagnation. Can you just use the blood stagnation to explain all the symptoms? For example, dizziness, blurred vision. Can you use the blood stagnation to explain all the symptoms? Or can you use the blood deficiency to explain all these symptoms? Or say, oh, there's a mass, the purple tongue. Can you say this is blood deficiency? We say, oh, probably not. So that means you cannot use the blood stagnation to explain this symptom. You cannot use the blood deficiency to explain this symptom. That means I need to think about more than one pattern. More than one pattern. Okay. So usually we emphasize the blood stagnation always show the purple face, purple tongue. But the question is, if the patient's the tongue is not the whole body, just like purple spots. So purple spots in the pale tongue, this is possible. So that's why you can see the pale tongue with the purple spots.
Are they spots like prickles or spots like?
Just like a little bit of purple, little bit of purple, little bit of like this. Yeah. So this is possible about you can see the purple spot, but the whole body shows the pale color. So this is about like a blood stasis in the blood deficiency. But for example, like a 四物汤, somebody say, oh, the 四物汤, usually we use that one to tollify blood, treat blood deficiency, right? But the question is, 当归川芎 in the formula, actually there's some like function to evaporate blood. So once you add like a 桃仁红花 into the formula, increase the circulation, tollify blood at the same time, because 四物汤 there's Baisao and 熟地黄 in the formula, right? You know this formula, six herbs, right? 6 herbs. Okay. The next one is talking about the blood cold. The blood cold. for memorize, or for to understand the mechanism, you can see the development. Patient catch the cold before, right? But this cold maybe is the young deficiency. So there are lots of different things when you think about it. For example, which age group is indicated young deficiency? Senior patient is indicated young deficiency. Or you can say patient, if you know the patient past the history, patient had a cold disease before. But ideally, if you can gauge the patient past the history, but sometimes we cannot gauge, so we just based on current symptoms or signs. So this is about one plus another one. So blood cold, cold in the blood, what's the result? Blood stasis. Slow down circulation. So that means patient might show cold hand, but it was the young deficiency or the cold hand, the cold feet, right? But the cold, like young deficiency, cold, this is just the cold sensation, the cold symptoms or signs, no any blood symptoms or sign, right? Like purple, or sometimes like the cold pain. So that means here we need to, this one plus this one. This one's emphasize the blood slow down, like blood circulation slows down, accumulation. That means once the circulation slows down, purple, or sometimes swelling. And the cold means just the plus the cold sensation, Or you can see moist tongue coating, or the pulse, the frequency decrease. So this one, if you look at this, 1, 2, 3, this is about just the blood stagnation. 100% blood stagnation, 1, 2, 3. But the question is, 1, 2, 3, 4, 5, and the Qi deficiency, cold, heat, this is about how many possible reasons to cause the blood stasis. The cold, sometimes we call the cold is the number one, cause the blood stasis. So that means the cold invaded the body, gradually cause blood stasis. The cold is still there. Cold is still here. So that means cold symptoms, cold sign. So the 1, 2, 3 plus this one. But actually, if we just do some change, for example, you said heat, fire may cause blood stagnation, but I should see 1, 2, 3, 4. 1, 2, 3. This is exactly the same. What's the difference? This one change to the heat, So this is about. I should see. You can use this one to match different things. For example, 1, 2, 3 plus what? Plus fatigue, low energy, low body weight, skinny body weight, skinny body constitution. If we plus all this, I say, this is the Qi deficiency, blood stagnation. If it's plus heat, you can see this is blood, like a heat or fire caused blood stasis. Like Dr. Ye, like epidemic worm disease doctor, he mainly just focus on something, because, for example, the epidemic worm evil enter the blood. Which one you need to pay attention to emphasize? I mean, he just emphasized how to treat the evil qi. Even into the blood, absolutely consume the blood, cause the bleeding, but this is still the evil qi. So in his treatment, he just cooling down the blood. That's the primary treatment. It's not a totally for the blood, not the evacuated blood, but he's just cooling down the blood because of the heat. So you can see even the heat into the blood, but the treatment is not focused on the blood stasis mainly. He just treated the evil qi, cooling down the blood. So you can see like the herb, like herb 1. There's one chapter about the herbs can cool down the blood, once it's cooling down the blood, you can stop the bleeding. You don't need to use the stop bleeding herbs. You just cool down the blood that can stop bleeding, right? Okay, so warm the channel. I mean, this one I should see because in the cold, actually there's like how to differentiate excess cold or yang deficiency, right? Because in here is a yang deficiency, invasion or cold. Actually, there's big difference. What's the big difference? Choosing the herb. So once you learn the herb, you say, oh, some of the herbs mainly totally for the yang. So there's one chapter called yang tonics. What's the yang tonic? Yang tonics actually increase body yang qi. And there's another chapter, herbs is for expel. It's hot, it's warm, but it's just expel. Expel. So that's in the herbs also show the difference in treating excess heat, the cold or the yang deficiency cold. So you can see the formula here. 当归四逆汤 this is the decoction. What's the 四逆 means? 四 1 2 3 4. That's 2 hands, 2 feet. That's 1 2 3 4. What's the ni? Ni means wrong direction. What's the wrong direction? There's the correct direction. So it means yang qi from the chest, from the abdomen, from the heart, from kidney, reach to the fingers. That's the normal direction. If it's go from here, that's the wrong direction. They're called the ni, N-I. It's because patient is cold sensation is not start from here. It's start from the finger, from the toe first. From here to here and to here. That's the wrong direction. So we call the sni. So that means patient cold sensation start from the toe, from the finger first, and it goes upward. That's the wrong direction, right? So that's just indicate the cold sensation or know enough like yang to warm the finger or toes, right? Okay. And there's one the cinnamon. It's the cinnamon tree. What's the cinnamon? Warm. Pungent warm. And another herb is xixin. That's also pungent warm. Okay. Fresh ginger. That's a cinnamon tree. All this is what probably like the herb theory, the TCM herb theory is about the twigs stretch out, right? So once you use the twig, it can stretch out and move forward. So that means can help. It's warm, but it can help expel the evil, cold evil, and it can also help to unblock the channel. Like a cold stagnation causes the obstruction in the meridian, right? Okay, so this is another one about blood stasis with heat. Actually, we were already talking about this, the heat, right? The heat causes the, but sometimes you can see, from the development of the patient has a heat first, the heat in the blood and the cause, but sometimes the patient eats the blood stasis, catch the like a warm emoji. That's also possible. Okay, so you can see the one I already mentioned about the 1, 2, 3 should be exactly the same. 1, 2, 3. What's the 1, 2, 3? This is the 1, 2, 3. Stepping pen, the purple tongue, a purple face. That's the 1, 2, 3 is the same. They're the same. The difference is what? The difference is dry, thirsty, fever. Okay. In the Dr. Ye, as I mentioned about the Dr. Ye is the epidemic wound disease. The epidemic wound disease, you are in with the body in different level. Finally, the evil chi into the blood. So you can think about once the heat or fire into the blood, what will happen? So the heat into the blood, just like it expand or move forward too fast, bleeding. That's the important. And once the blood get hot, so the mental activity, patient is harder to fall asleep or like a mental disorder. So all of this, but except this I already mentioned about the consume the blood and also condense the cause blood stasis. So that means the primary main treatment that you're cooling down the blood, but also there's some herb to evacuate the blood. So or some of the herbs can do both. For example, one herb. This herb has two functions. One, cooling down the blood. Second one, evacuate the blood. So that means you can find an herb in Dr. Ye's formula. This can do both. So that means can cooling down the blood and also can evacuate the blood. So this is about the heat heat in the blood. So the difference, you can see what's the difference between the cold. This is this one, fever, bleeding, together. But the cold, what's the cold? You get the cold sense in cold feet. That's a big difference. So that's the difference for the blood cold, blood heat. So clear heat move the blood stasis. So you can see Dr. In 2,000 years ago, like Dr. Zhang, he had one formula called the Taoren Chunqi Tang, or Da Huang Mudan Pi Tang. Okay, there's both formulas from Dr. Zhang. Especially this one for the appendicitis. So appendicitis, you can that's the patient has a high fever or patient abdominal pain. Looks like this is just the like a Western doctor, this is the infection, right? But actually, in TCM treatment, can use for example, this is the induced diarrhea, but the Da Huang is not just the induced diarrhea. Da Huang can evacuate the blood and clear the heat. So this is the good one I mentioned about. This herb is good for cooling down the blood. First one. Second one, evacuate the blood for both blood heat and blood stagnation. Excellent. So Taoren, that's common herbs for blood stasis. Okay. So the except the blood stagnation plus heat. That's the heat in the blood stasis and cold in the blood stasis, right? But right now is only talking about the blood heat. So this blood, probably we can stop for a while. Okay, just stop for a while.